Hello everyone, welcome back po ulit sa ating channel, and for today's video, we are going to discuss another disorder of the gastrointestinal system, which is what we know as your peptic ulcer disease or your PUD. But before we proceed to the actual discussion, guys, please don't forget to subscribe, like, and please comment for suggestion ng topics and share this video to your friends. When I talk about peptic ulcer disease, this is actually another common disorder of the gastrointestinal system. So the peptic ulcer disease is basically this one. As you can see, this is actually a part of your gastrointestinal tract, okay? And there is actually a excavation. Okay, there is an excavation or a crater, which actually a sugat in our gastrointestinal lining. So with this picture, let us define what is PUD or peptic ulcer disease. PUD or peptic ulcer disease is an excavation that forms in the mucosa of the gastrointestinal tract. So your gastrointestinal tract is basically from your mouth to anus, and your peptic ulcer disease is commonly affecting now your esophagus, your stomach lining, and of course your small intestine or your duodenal lining. Okay, so what causes now your peptic ulcer disease? Why is it occurring or happening? So your peptic ulcer disease is caused by an erosion of a circumscribed area of the mucosa due to an increased concentration, increased concentration of activity or activity of acid, such as your pepsin, and the decreased resistance of protective mucosal barrier. So two things happens here. Okay, there is an increased acid concentration in our stomach plus decreased resistance. Okay, decreased resistance of mucosal lining. Okay, mucosal lining. And talk about acid, we are referring to the pepsin and other acids such as your hydrochloric acid. So that is the etiology of how peptic ulcer disease occur. Now, there are several factors that can contribute for this etiology to occur. What are those risk factors? Number one is that old age. So commonly, old ages or old person actually has a decreased intestinal production of protective lining of our gastrointestinal tract, causing now their intestinal or gastroesophageal lining to be more at risk of the erosion caused by the increased concentration of your gastric content. Okay? Another one is the prolonged NSAID use o yung paggamit ng mga non-steroidal anti-inflammatory drugs such as your aspirin. Okay? So, alam naman natin na pag tayo uminom ng mga NSAIDs, dapat po tinitake natin to with foods because this can cause this can actually lead to the development of peptic ulcer kapag prolong ang use. So what are example of those? Example are your Alaxan, ibuprofen, okay, Advil, aspirins. Those are NSAIDs, and those can contribute to the development of this condition. Another one is the presence of your infection or your Helicobacter pylori infection, and this is actually the most common. So among all the risk factors, this is actually the most common. Okay, the most common and common to those individuals who are actually blood type O. Common to individuals who are actually blood type O. For what reason? According to study, H. pylori infection is the #1 risk factor that can contribute to the development of the condition, and common siya na nakikita sa mga tao na blood type O. Okay? Another one is smoking plus alcohol consumption, because this increase now your gastric content secretions, plus it also weakens our immune system and the resistance of our gastrointestinal lining. Familial history, okay, and just like I said earlier, if you are a blood type O individual. And again, if you another one is if you do have a chronic condition such as COPD or chronic obstructive pulmonary disease or disorder, chronic obstructive pulmonary disease or disorder, cirrhosis, specifically your liver cirrhosis, and your chronic kidney disease. Okay, another one is your Zollinger's Ellison syndrome. So Zollinger-Ellison syndrome is actually a benign or a malignant tumor of the pancreas, wherein it secretes excessive amount of the hormone gastrin that leads to hyperacidity and severe peptic ulcer disease. So basically, this is a condition of the pancreas or duodenum, and this tumor o yung bukol na yon nagpo-produce siya ng tinatawag na gastrin, and this gastrin increases now the activity, the hyperacidity of the gastrointestinal lining that will lead to severe peptic ulcer disease. So those are the factors that can contribute to the development of your peptic ulcer disease. Now, the etiology of your ZES or Zollinger-Ellison syndrome is actually unknown, but according to the book, it is linked to the inherited chronic condition called multiple endocrine neoplasia type 1. Okay? Multiple endocrine neoplasia type 1. So kung tinanong sa board exam nyo or sa exam nyo about Zollinger-Ellison syndrome, the exact cause is unknown, but the most common related link is the multiple endocrine neoplasia type 1. Now, there are several types of ulcer. Okay, and the types that I will be discussing is related to where you can find or where does the ulcer located. Okay, is it located in your esophagus? Okay, so if it's located in your esophagus, we will call it as esophageal ulcer, and this is due to the backflow of hydrochloric acid, which is common sa mga pasyente na may GERD or gastroesophageal reflux disorder. So if you don't have an idea about your GERD, I have made a video of this one. Kindly check my channel, okay, and of course kindly check the video about it so that you'll be able to understand how come na nagde-develop ng peptic ulcer or esophageal ulcer ang pasyente na may GERD. Okay, aside from that, if the ulcer is located in your gastric area or stomach, we will call it as gastric ulcer. And gastric ulcer is commonly located in the lesser curvature of the stomach near the pylorus. Okay, and the third one is under your duodenum. We will call it the duodenal ulcer, and again, duodenum is the first portion of the small intestine after the stomach. Okay, so and according to our book, this is actually the most common type. Actually, sa ating book, this accounts 80% of all the cases, this accounts 15% of the cases, and this accounts 5% of all the cases. So, kung common ang pinag-uusapan natin, it's more on duodenal ulcer. So, it's more on duodenal ulcer. But aside from these types, there is also a certain type or a certain type of ulcer that is common also na nangyayari sa ating gastrointestinal tract. Okay, different from your peptic ulcer, but in terms of the manifestation, they actually do have the same manifestation. We call it as your stress ulcer. So what makes it different from your peptic ulcer? So stress ulcer is a term given to acute mucosal ulceration of the duodenum and gastric area that occurs after physiological stressful events such as burns, shock, sepsis, or multiple organ dysfunction. So, peptic ulcer occurs even without these conditions. Kahit hindi nasunog ang pasyente, nag-develop ng shock, sepsis, or multiple organ failure, ang peptic ulcer ay nagde-develop simply because mataas ang gastric content or the acids and mababa ang resistance ng ating gastrointestinal lining. Okay? While stress ulcer commonly occurs and it follows yung pattern kung paano lang nangyayari ang ating ulcer, peptic ulcer, pero mas nagde-develop siya during a stressful situation, such as the following. We have your burns, shock, sepsis, and multiple organ dysfunction syndrome. So stress ulcer is clinically different from peptic ulcers and are most common in patients who are ventilator dependent after a trauma or a surgery. Ibig sabihin, sa mga bedridden patient, common po ang tinatawag na stress ulcer. So stress ulcer is characterized or has the following patterns. So during a fiber optic visualization or your endoscopic procedure, we may observe the following. For the first 24 hours after the trauma or surgery, there is the creation of a shallow erosion on the stomach wall. And by 72 hours, there is a multiple gastric erosions that were observed in the gastrointestinal lining. It's either in the duodenum or in the stomach. This ulcer will spread as a stressful condition continues, and once the stressful condition backs to normal, okay, the lesions will also reverse, okay, or the lesions are reversed when the patient starts to recover. Okay. So that's the characteristics of your stress ulcer. Unlike yung peptic ulcer, hanggat hindi natin ginagamot is hindi siya gumagaling. Okay. The etiology of stress ulcer is basically the disruption of the normally protective mucosal barrier and decreased mucosal blood flow, okay, due to ischemia, reflux, and duodenal contents into the stomach. So in comparison to peptic ulcer, it is more on the decreased resistance, mucosal resistance, and the increased acid concentration, while the etiology of stress ulcer is more on the blood flow that is leading now to ischemia, then eventually death of the tissues in your gastrointestinal lining, causing now excoriation in our gastrointestinal area. Now, there are specific types of stress ulcer. So again, sa peptic ulcer kanina, depende kung saan nakalagay yung ulcer, if it's in esophagus, yung stomach, or gastric area, or duodenum. Sa atin naman pong stress ulcer, depende kung ano yung nagkukos ng ulcer. So it can be a Curling's ulcer, wherein it is an ulcer observed 72 hours after an extensive burn injury. So, ibig sabihin, kapag nagkaroon ng burn injury ang pasyente, ang tawag sa ulcer niya, specifically, the stress ulcer niya is your Curling's ulcer. And it is Cushing's ulcer naman po pag ang pasyente ay nagkaroon ng head injury, stroke, or brain tumor, or any problem that can cause increased intracranial pressure. Because this increased intracranial pressure will overstimulate the vagus nerve and increase the production of hydrochloric acid. Curling's is burn, okay? Cushing's is brain, okay? So related sa brain, related sa burn. Those are the two specific type of your stress ulcer. Now, what are the clinical manifestations of both this condition, the stress ulcer and the peptic ulcer disease? This includes severe, sharp abdominal pain, specifically sa ating epigastric area. Okay? Another one is your pyrosis. So as we already discussed in the previous video, pyrosis is your heartburn. Patient will also suffer from either constipation or diarrhea and a constant burping because of the indigestion. Okay? Vomiting may also occur as a result, as a complication. So when there is already a complication, especially sa ating gastric and duodenal ulcer. Okay? Emesis, okay, that contains undigested food will also be manifested with this patient. GI bleeding, either hematemesis or an upper gastrointestinal bleeding, or a melena, which is also another upper gastrointestinal bleeding. So ito yung sinusuka, ito naman yung tinatae. So but they are both upper gastrointestinal bleeding. Okay? Patient will also manifest the following, depende kung siya ay gastrointestinal or duodenal. But for both, hypotension and tachycardia is also present, which is an indication of an impending shock, okay, due to bleeding. And for gastric ulcer patient, they will feel pain immediately after eating. So when they eat within 30 minutes, they will feel epigastric pain. That's an indication specific for gastric ulcer. At duodenal ulcer naman is pain occurs 2 to 3 hours after eating. Okay? 2 to 3 hours after eating. So ito immediately within 30 minutes, Ito naman is after 2 to 3 hours. Established, we are now ready for the diagnostic test. For the diagnostic test, guys, okay, first is of course your physical examination. So this will collect now the objective data coming from the patient as observed by the examiner, which is most commonly the nurse or the physician. Okay, another one is the upper GIT endoscopy. This is to visualize. Okay, so to visualize the upper gastrointestinal tract. Okay, and this is actually the confirmatory test. This is actually the confirmatory test. Okay, this is the confirmatory test, which includes now your barium swallow. So upper GIT po yan. So to visualize the upper GIT. Now, another one is if possible, okay, with endoscopic procedure, they're going to collect specimen for biopsy and histologic examination, plus the upper or the rapid urine test. So basically to check for any possible malignancy. Okay. Another one is to check for the presence of H. pylori antigen. As we have discussed in the earlier part of this lecture, H. pylori is actually the most common risk factor for the development of your peptic ulcer disease. Another one is the stool antigen test, again for the presence of the infection in the stool of the patient. The urea breath test to include your CBC and occult blood test for the presence of your unseen blood or the presence of RBC or red blood cells in our stool. And of course your gastric secretory studies to check for the levels of the gastric acids or the gastric contents present in our gastrointestinal tract. So those are the diagnostic tests to establish a confirmed diagnosis for the peptic ulcer disease. Now, how are we going to manage the condition? So for the management of the condition, the goal of the management is to eradicate H. pylori, because that is the most common risk factor, and of course manage the gastric activity, which is to decrease the gastric secretions of your gastric content, such as your hydrochloric acid. Now, to start with this medical management, number one there is the pharmacologic management. For the pharmacologic management, note that this is a combination approach of antibiotics, your PPI or your proton pump inhibitors, and your bismuth salts. And under your pharmacologic management, these are some pharmacologic interventions specific for a specific purpose. For number one here, under your pharmacologic management specific for ulcer healing, okay, we can give your H2 receptor antagonists such as your tidine, so tidine, ranitidine, okay, such as your ranitidine or your H2 receptor antagonist. So we are going to give this for the first for 6 to 8 weeks. 6 to 8 weeks for complete ulcer healing, and an extension of 1 year for maintenance, especially for high-risk patient. Another one is your PPIs. Examples are your omeprazole, pantoprazole, esomeprazole, okay, and your PPIs is given for 4 to 8 weeks for complete peptic ulcer healing, and a maintenance for a period of 1 year. So these are the drugs that can be given to patient to promote healing process sa ulcer ng pasyente. Another pharmacologic management, but this is specific for H. pylori infection or to kill the H. pylori infection or H. pylori bacteria, is the triple therapy approach. Under your triple therapy approach, we are going to give a PPI or proton pump inhibitor twice a day, plus or combined with clarithromycin 500 mg twice a day, plus 1000 mg amoxicillin also twice a day, or pag walang amoxicillin, you can give metronidazole 500 mg twice a day. And these three will be given for a period of 10 to 14 days. Again, triple approach po ito. PPI, clarithromycin, plus either amoxicillin or metronidazole. And these three will be given for the next 10 to 14 days of therapy. So aside from the triple therapy, we also have your quadruple therapy. So from the word itself, quadruple, this is actually a combination of 4 drugs. Number 1 is your bismuth. We'll be giving bismuth of 525 milligram twice a day. Tetracycline for 500 milligram twice a day as well. Metronidazole 250 milligram plus PPI, which is given daily for a period of 10 to 14 days. Again, this both approach, the triple and quadruple approach, will be given to address the H. pylori infection. Another pharmacologic intervention is the prophylactic therapy for NSAID ulcers. So prophylactic therapy means to prevent, okay, the occurrence of ulcers related to the use of NSAIDs. So for this one, peptic ulcer healing doses of PPIs. So we may use use the peptic ulcer PPI or protein pump inhibitor dose. Okay, sa ating when you given to patient who are healing ulcer, plus your misoprostol 100 to 200 milligram QID. Okay, QID or 4 times a day. So those are the pharmacologic management for your peptic ulcer disease. Okay. Now, another interventions or management to include, aside from your pharmacologic management, it needs to be combined with smoking cessation. As we already know, one of the risk factor of developing your peptic ulcer is the use of or the consumption of smoke, okay, or tobacco. So we have to do smoking cessation because smoking decreases bicarbonate, okay, and bicarbonate is actually alkaline. And take note that acids are acid and kalaban niya si alkaline. So when you smoke, it decreases alkaline or the bicarbonate, causing now increased acidity in the duodenum. And it's also associated with delayed healing. Aside from that, dietary modification. So what is the dietary modification for patient with peptic ulcer disease? To avoid over-secretion of acid hypermotility of GIT. So avoid extreme of temperatures in terms of foods and beverages. Bawal ang masyadong mainit at masyadong malamig. Okay? Avoid alcohol, coffee, and other caffeinated beverages because these substances are known to have increased the secretion of hydrochloric acids or gastric contents. Of course, do not skip meals. You have to eat 3 times a day, regular, 3 times a day. Okay, 3 meals a day. And small frequent meals is not necessarily advisable or advised for as long as the patient is using antacid or H2 blockers, okay, to control the condition. So, hindi naman kailangan na small frequent meal. Basta kumakain ka ng 3 beses sa isang araw at nagtitake ka ng antacids. Okay? Eat tolerated foods and avoid foods that cause pain. Okay? Avoid foods that cause pain. And of course, you have to be aware yung sa ating gastric and duodenal. Kapag yung condition is gastric, you would expect na pwede ka magkaroon ng pain during the first 30 minutes after eating, while duodenal is 2 to 3 hours after eating. Okay, so in this case, kailangan iwasan mo yung mga pagkain na nagkakos ng over-secretions. There are some books na nagsasabi that spicy foods also increases the of your gastric contents. That's why you also need to avoid spicy foods, aside from the foods that are very hot and very cold, plus caffeine and other caffeinated beverages. Okay. For surgical management, patient may undergo vagotomy. Vagotomy is the removal of vagus nerves. Okay, removal of vagus nerve. Vagus nerve, with or without pyroplasty. So pyroplasty, pylorus, is basically the plasty is repair. So repair of the pylorus. Okay? Repair of the pylorus po yan. So with or without. Okay? Patient will also undergo anthrectomy. So anthrectomy is an operation, okay, operation to remove your pylorus or pylorus. Okay, remove pylorus. So an operation to remove your pylorus. Okay, an operation to remove your pylorus. Okay, pylorus. Yan. Another one is your Billroth 1. So Billroth 1 is basically Billroth 1 and Billroth 2 are both anastomosis. Okay, so basically magkakaroon tayo ng anastomosis. Magkakaroon ng artificial connection. So connection. So a portion of the stomach were surgically connected, okay, into the duodenum kapag Billroth 1. Duodenum. While your Billroth 2 naman is anastomosis sa jejunum. Okay? Jejunum. Okay? These are both anastomosis, okay, or connection of the part of the stomach or portion of the stomach from the stomach to duodenum. That is your Billroth 1. From stomach to jejunum, that is Billroth 2. Okay? Billroth 2. And those are the surgeries that will be done to patient to manage the condition kapag sobrang lala na. Okay? And these surgeries, your vagotomy and tracheotomy, Billroth 1 and Billroth 2, may lead to these following complications, such as your dumping syndrome. So dumping syndrome, or also known as your Casper's disease. So basically, ang Casper's disease siya kasi pag kumain siya, okay, diretso agad or ang bilis niyang dumumi. Yun ang tinatawag na dumping syndrome. So pag kumain siya, almost the same pa rin or hindi, parang undigested yung kanyang idinumi. Yun ang dumping syndrome. Aside from that, patient will also suffer from pernicious anemia. Pwedeng mag-develop ng pernicious anemia since affected po ang ating gastric lining, and gastric lining, okay, affected gastric lining may lead to decrease intrinsic factor, and may lead to decrease absorption of B12. Okay, decrease absorption of B12. By the way, ang pathognomonic sign ng pernicious anemia is your red beefy tongue. Okay, your red beefy tongue, o yung dila niya is parang karne ng baka ang itsura. Red beefy tongue. Okay? Red beefy tongue. That's the pathognomonic sign of your pernicious anemia. Again, pernicious anemia occurs when there is an injury sa ating gastric lining, and because of that, magkakaroon tayo ng decreased intrinsic factor, and this intrinsic factor is supposedly absorbing your B12, but since kokonti ang intrinsic factor, ibig sabihin kokonti din ang ma-absorb na B12. Okay. So aside from that, relieve pain. So relieve pain, administer prescribed medications, but avoid aspirins and other NSAIDs because these are included sa risk factor ng condition natin. Okay? Give regular medications and use relaxation techniques to manage stress. Again, avoid aspirin and other NSAIDs, but give the prescribed medication as ordered by the doctor. So, but if this is something NSAID, you have to question the doctor's order. Okay. Reduce anxiety by giving health education on how to manage stress and anxiety. Okay, you can also ask the patient to do deep breathing exercise and other relaxation exercises. Maintain also optimal nutritional status by eating tolerated foods and avoid foods that can exacerbate the patient's condition. Okay. Monitor and manage potential complications such as vomiting, hemorrhage, perforation, and penetration, and gastric outlet obstruction. And for the possible nursing diagnosis for patient with peptic ulcer disease, okay, patient may have diagnosis such as your acute pain related to the effects of gastric acid secretions on damaged tissue, or anxiety related to acute illness, imbalanced nutrition, less than body requirements related to diet changes. So these are the three possible nursing diagnoses that can be applicable depending to the client's situation. So there you go. That is the discussion about your peptic ulcer disease. Again, if you do have any questions, please comment it down sa ating comment section. Don't forget to subscribe subscribe, like, and share this video. And please wait sa ating mga next videos about the disorder of the gastrointestinal system. That would be all. Bye for now and see ya.